The Minister of State, Ministry of Social Justice and Empowerment, Government of India, Pratima Bhoumik, virtually inaugurated the services of the Composite Regional Centre for Skill Development, Rehabilitation and Empowerment of Persons with Disabilities, Divyangjan, CRC Shillong, on the 17th of May 2022 at a function held in hybrid mode at U Soso Tham Auditorium, Shillong. The Minister of State inaugurated the service of the CRC Shillong by switching on a walk-through video of CRC Shillong. Those present during the event included Secretary, DEPwD, MSJ&E, Government of India, Anjali Bhawra, Principal Secretary, Department of Social Welfare, Government of Meghalaya, Sampath Kumar, Commissioner for Persons with Disabilities, Government of Meghalaya, SB Marak, Director NIEPMD Chennai, Nachiketa Rawat, Director CRC Kozhikode and Nodal Officer of CRC Shillong, Dr. Roshan Bijli, Deputy Registrar Administration NIEPMD S. Shankara Narayanan, Senior Officers of the NIEPMD and CRC Shillong. In her inaugural speech, the Union Minister of Social Justice and Empowerment emphasized on the government's commitment to make CRC Shillong a substantial resource center for persons with disabilities in the entire state of Meghalaya. The minister also thanked the state government for providing 10 acres of land for establishing a dedicated building for the CRC Shillong at Umsauli, New Shillong, and said that the construction of the building will be started shortly.
And the state government has allocated land for setting up of this composite regional center, because this is going to be a very important institution for the state. Because once you have these institutions, there is a growth. So there is a growth, there is a support system for the people. All these national centers, the regional centers play a very important role. In fact, if you look at the history across the world, wherever these institutions of excellence come, there is a growth, there is a development. So we have, I think we are very fortunate that Shillong has been attracting, has been becoming a center, a regional center for many such initiatives, and they go a long way, especially for the development of the state and also the entire northeastern region. So having said this one, I also wanted to say a few words on this, importance of why actually we have to really focus on empowerment of persons with disability. See, as per the WHO, I think these figures are really, astonishing. 600 million people across the globe actually are suffering from disabilities, as per the WHO estimates. So that is quite a huge number, and these are essentially due to chronic diseases, injuries, violence, infectious diseases, malnutrition, and other causes related to poverty. So it's also a problem of a public health, and it's also a problem of socio-economic status of the people. So we need to address those issues at the source to really see a change in terms of the empowerment of Divyangjan. So the government of Meghalaya is working on that direction of a holistic approach. So we have now been working very systematically to organize all the people, especially the rural areas. We have about 80% rural population lives. We have organized almost every household into women self-help groups to provide a support systems. So, and economically, now these women groups are actually economically empowered, taking care of children, taking care of malnutrition. So all these things would definitely lead systematically in empowering people. So I'm sure this CRC, what has come and what has been given by the Government of India, to the state and also to the region, I think it is a great thing that has happened to all of us, and we really grateful for this initiative by the Government of India.
Minister in charge, Department of Social Welfare, Government of Meghalaya, Karmanchilla, distributed the aids and assistive devices under the Government of India's ADIP scheme to around 55 beneficiaries. In his address, the minister said that the government of Meghalaya will continue to support CRC Shillong to live up to its full potential in producing excellent works, and added that the government was only happy in providing 10 acres of land for CRC Shillong at Umsauli.
CRCs have been established in many other states, and they all are working for skill development, rehabilitation, and providing empowerment to the person with disabilities. Our Meghalaya government is providing 10 acres of land for CRC Shillong at Umsauli, and also helping them in setting up early intervention center. I hope that CRC Shillong will be able to serve the Divyangjan of all 21 categories. There are various important initiatives by the state government for the welfare of Divyangjan, such as organizing a DIP camp and distributing assistive aids and appliances, universal ID card for Divyangjan, which will be valid all over the country for the needs of Divyangjan, and Accessible India campaign is also in progress nationwide, which enable Divyangjan to move smoothly at the railway station, bus stand, airport, and are important public place.
The MLA of East Shillong constituency, Maisel Amperine Lingdor, while addressing the gathering, said that there should be early identification and proper intervention of disabilities, and added that the entire differently abled population far and wide in the state of Meghalaya should be able to avail of the facilities offered by CRC Shillong. Lingdor assured all her guidance and assistance for the better functioning of the CRC Shillong.
I come here with goodwill. I come here to lend support. I come here to be a part of this program that will see that people with disabilities are attended to. I'm happy to see that there is a large component of education and skill development for people of this category of citizens. We must work hard. Every constituency in the state of Meghalaya must ensure that they are a part of this good venture to empower the different people in our communities who have these disabilities, who have children with disabilities, are no longer ashamed to talk about the disability of their children. This is a good growth, a good development. It is for us people in government, people in office, public offices, who can help change their lives and partner with all the NGOs, the parents, who are already on the ground working